Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm Dr. Ramanathan. I'm a board-certified plastic surgeon in New Jersey.
And I'm Dr. Ashley Amalfi. I'm a board certified plastic surgeon in Rochester, New York. And we are so excited, Smita, to talk about one of our hot topics, which is Botox. We talked all about Botox and filler, but today we're talking about preventative Botox. So this is such a hot topic, and you're hearing very young people who are coming in for Botox. And, the question is that crazy? Or is it smart? And we're here to give you real, unfiltered answers as to, why we think preventative Botox is a really good thing. So,
Absolutely.
so is this something
I'm,
that you're seeing in your practice, Smita?
yeah, I think pretty much daily I get this question because oftentimes, I feel like there's two sets of patients, right? There are patients that are already starting to see those wrinkles that are permanent in their skin. And at that point, it's not that it's too late, but you've kind of missed the boat a little bit, right? Because those wrinkles are already permanent. And then you get the younger patients that are starting to see it on social media and starting to see other people really start, talking about Botox, and they come in a little curious. They're intrigued, they're interested in it, they're nervous, obviously, which is where we come into play to sort of, educate and make people feel comfortable with whatever decision they choose. How about
Yeah.
you? Are you seeing a lot of it?
Yeah, that's exactly what I see. I saw a girl today actually who came in for her very first treatment, and she said she went to dinner with a bunch of her girlfriends who are all the same age. And she's like, what am I missing? Why are you guys like glowing? And you guys all look so great, and your skin looks so good. And they're all like, we all started doing Botox. And she's like, why didn't you tell me? And so she was like
Right.
so eager to come into the office and get it done too. But yeah, it's not uncommon, and they're just glowing, and it helps their skin and their pores, and it's a really good way to just get into a really, really good routine to prevent that
Right.
those signs of aging.
Right, exactly. And I think what is so cool when you do start a little bit younger, so we're talking, in our mid to late 20s, maybe, certainly you're not doing this when you're a teenager or anything like that. But yeah, sort of mid 20s. Right. But you sort of weaken that muscle enough. So these muscles are sort of lying right underneath the skin. And so every time you animate or you raise your eyebrows or you furrow your brows or you smile even, you create those wrinkles, which when you're younger, they just disappear because you have really healthy skin that's full of collagen. But as you get older, which unfortunately we start losing collagen in our skin once we're in our 20s, early 30s, those repetitive motions become permanent lines in our skin. So with Botox or Dysport or any of those neuromodulators, you're weakening that muscle so that you're not seeing that repetitive movement on the skin and you're not getting those permanent lines. So it's really, and I think it's great also, and we can talk about this on another episode about skincare, because you kind of really want to use a retinol and Botox hand in hand. They work complementary.
Yeah, and it's really, at that point, it's part of just establishing that good care. And when you're getting those neuromodulator treatments, you don't need to get them all the time. And the question is always like, if I start really young, am I hooked? Like, can I not ever not have Botox ever again? No, you can stop at any point. And that's kind of the cool part, is like you don't have to do it totally regularly because you're not forming those harsh lines. You're just lessening the amount of time that those wrinkles are being created, which is just helping the skin stay healthier longer. So most of my young patients are really getting preventative Botox two or three times a year. So it's really just kind of a part of their annual beauty and sort of wellness maintenance. And it's not like, oh my God, if I'm overdue, anything bad's going to happen. No way. The more times you do it, the better, the more you're preventing. And you're by no means stuck or hooked, but we promise you'll love it.
Yeah, but I think people are hooked just because it's
Yeah,
so great.
it's great.
Um,
Yeah,
it's
yeah.
so great. But I agree with you. I mean, most of my patients for preventative Botox come in two or three times a year, and you need a little amount of Botox. I usually call it a sprinkle of Botox, just enough to sort of weaken that muscle. You're still making all of the movements, but you're not getting the negative stuff with it. But I think every single person who has gotten it has just been like, well, why didn't I do this sooner, right? Like my skin looks so amazing. And so you're just hooked by nature of how amazing the results are. But like you said, by no means does it make your aging worse if you stop? You just sort of go back to what your normal is.
Yeah, yeah, that's
But
a
it's
common
sort of a great
question.
thing.
Yeah, that's
Yeah.
a common question. Like, if I stop, are things going to look worse before they started? No way. But you're also aging. So, like, if you've been doing Botox for 5 or 10 years, well,
Right.
you're 5 or 10 years older than before you ever had that. So things might look a little different with no medicine in your forehead than what
Yeah.
it looked like when you started. But it doesn't make anything worse. It only helps us age in a better way. Do
Right.
you get a lot of questions about, if I'm doing this really young, am I going to have no options when I get older? Am I going to become immune to it? Because I do hear that from time to time.
Yeah, I mean, I hear that, not very often like you, but I mean, I do tell them certain neuromodulators have a higher protein level. So, Botox is one of those that might have a little bit more than Xeomin, for instance, or Dysport. But so our body does have the potential to recognize those proteins and create antibodies. So you might need more, as we sort of go along, or it might not be as effective. But the great thing is, there's 4 neuromodulators on the market
Right.
right now.
Sure.
So, yeah, so you can always change things up. And that's often what I tell people anyway, when you're first starting, is try all 3 or 4 of them, see which one works best for you. And then take it from there. But you do have the opportunity to switch, and it is normal to sort of increase your dose as you are getting older, just because, as you said, you're aging. So you
Yeah.
have to kind of compensate for that. How about
Yeah.
you?
Yeah, same. Or we're treating more spots, and so your dose does change. And so we'll have
Right.
people come in for a dose adjustment if that's what they need. But yeah, by no means do you have to worry that you're setting yourself up for like this disaster in your 40s and 50s where nothing works on you. Those patients do happen, but I don't think it matters when they start. I think their bodies are going to form those antibodies no matter
Hmm.
what. But you got to remember, this is a really rare group of people. Most people, everything really works on them. And if, we're trying one brand, then sometimes we'll just swap to another brand and see how that works. And so there's so many options in the world of neuromodulators that I don't think that should be something that you're really concerned about. We're not concerned
Right.
about it. We've been
Right.
doing it since our 20s, and I'm not worried that I'm setting myself for anything other than natural aging. So,
Right.
I don't think it's something that you guys should be worried about. I think it's a super positive thing, and you'll love
Right.
it. Yeah.
Yeah, I mean, exactly. I think if anything, there's more benefits to it, right? Because you're not getting those repetitive lines, you're not getting those permanent lines that are ingrained in the skin. And so once that wrinkle is in the skin itself, it's much harder to treat. Now we're sort of talking about resurfacing or other sort of skin procedures or surgery, so starting early does sort of decrease the chances of that happening. So it's a benefit overall. Do you get a lot of concern from patients about looking unnatural?
I think everyone is really concerned with
Yeah,
that. And,
right.
and, I usually tell them, you recognize all the people or even the people you don't know who have really bad treatments. So they have really bad surgery and bad fillers and bad neuromodulators because they look weird. They look
Mm-hmm.
bizarre, they look unnatural, they look surprised. But what you
Right.
don't notice is all the people who you're at a dinner party and you're like, oh my God, so and so looks great. Well, they probably have some stuff going on too, but theirs just
Mm-hmm.
looks really healthy and natural. So you absolutely can look very natural doing fillers and neuromodulators. You just got to make sure you're going to the right person who's going to be able to achieve that look. So just, do
Right.
your homework, make sure you're going to someone who's a board certified plastic surgeon, facial plastic surgeon, dermatologist, or trained by
Mm-hmm.
one. They work in a
Right.
medical spa that is run by plastic surgeons or the like. And so you just really want to make sure that you're going to someone who knows what they're doing so that they're not going to get these sort of unexpected results. They're going to have complete control over your look and also
Right.
change things. Like some people want an arch to their eyebrows, some people want it very flat. And those are the things that we talk about, and we get you the look that you want, and then we can tailor it as we go so that we get it
Mm-hmm.
just right for your anatomy, because everyone is
Right.
totally different.
Right. And I think that that's such an important point because, oftentimes I think a lot of injectors that are not trained by the core, specialties like we are, they go to a weekend course. And so they're sort of taught a one and done type of thing. Everybody gets the same dose, every muscle gets the same dosage. And that's obviously not what we want. That's sort of what, leads to these unnatural results. If you're getting more injected or than you need, or in places that you don't necessarily want. So it's a very personalized treatment based on your anatomy, what you're looking for, and like you said, we do have the ability to make minor adjustments so that you have a brighter eye, or if you definitely don't want your eyebrow shape to change, it doesn't have to. You can still have movement. We can adjust how much movement. There are people that want to be completely frozen, which, we can certainly do, but most people want to show expression and not look weird if they're like about to cry or, whatever it is. We have that ability to really cater it to you. And I think you're the same way as I am for any first timer. I always start small, we sort of know what that muscle needs, but sort of start conservative. You can always build from there. So you might see us a couple of times that first treatment, but then after that, we have your dosage down.
Yeah, exactly.
And so,
Well, yeah, we have them come back after their first treatment just to see how things are, to see, is this exactly what you were looking for? And we just talk about those things because, like we said, there's so many things that we can change to get it just right for you. And your anatomy is different than every one of your friends. And
right.
And we're going to tailor it to get you exactly the result you want. And then once we figure out exactly how you want it to be, then we just keep doing that going forward as frequently or infrequently as you want. And so it's a really cool thing to start. And I think it's a really positive thing to age. I'm kind of excited, Smita, to see this population because, this kind of Gen Z like really takes care of themselves. They're really into skincare and beauty and wellness. And they're starting all these things early because they want to age and look really good when they're middle-aged and older. And so It's going to be really cool to just see what a dramatic effect that's going to have on them overall. It's going to be a healthy, beautiful population.
I know, really. I know. I mean, and that's the thing, right? We're not, preventing aging, right? We're just allowing you to age gracefully, so that you can look and feel the best that you can when you're in your 40s, 50s, 60s. And then hopefully, minimize some of the other things that you might need to do at that point if you just started then, right? So, I think it's a great treatment. I think if you're thinking about it, you should definitely reach out to someone, go see a board certified plastic surgeon, or, an injector who's well trained and have that conversation. But you'll be surprised, you'll love it. Everybody does. And so you might as well just do your due diligence and look into it a little bit further.
Yeah. We promise you're going to love it. But absolutely. So many great topics to come on injectables, neuromodulators, Botox fillers. So stay tuned. Thank you so much for tuning in to Lipstick and Lipo. Make sure you subscribe. Yeah. And we'll see you guys more, unfiltered plastic surgery information from 2 board certified plastic surgeons. So we'll see you soon.
We'll see you soon.